Well, let's get started. Good afternoon, everybody. Thank you for joining on this fine Sunday. It's our Honoring Healthcare Heroes highlight for our Filipino American National Historical Society Museum. I think that might have been Goldie who just joined. My name is Jelissa Cummings. I'm the FANHS Museum Board Secretary. Terry and Erwin, do you want to introduce yourselves?
You go first, Terry.
I'm Terry Torres, and I am the manager of the FANHS Museum, and I'm also a FANHS National Trustee and a lifetime member of FANHS. And so, if you ever have any questions about the Filipino American National Historical Society, I'll be happy to answer anything.
Founding leader. Thank you, Terry.
Okay. Hi, I'm Erwin Mina. I recently was appointed president of the FANHS National Museum. Just wanted to acknowledge that this tribute, first of all, Jelissa and Terry, the work that you've done for this museum has been really outstanding, keeping the doors open. Wanted to basically make mention of why we're doing this talk in the month of March. As we all know, early in March 2020, the country shut down, but without hesitation, the first responders, doctors, nurses, and medical personnel stepped up and saved lives. And I think this is a deserved and heartfelt tribute from the FANHS Museum. Thank you.
All right, I'm gonna introduce our panelists. I'll go in order for folks who jumped on. Goldie is on. Goldie, can you hear us? There she is.
Yes, I can. I made it.
Yay. Hey, Goldie.
And thank you to Rudy for sending the info. So I'll introduce the three of you. You can share, if you can share, it's up to you if you want to share where you work. We all have jobs, and and my intent of this interview is not to put you in uncomfortable positions to answer any questions you don't want to. Because we all have opinions and we all have day jobs. But we open up a dialogue and just share about each of our respective experiences during COVID primarily, and then what's happening now. So we'll start with Miss Vivian Corpuz. Vivian, do you want to introduce yourself? How long have you been a nurse, and where do you work, and what department, and whatever else you want to share with us?
Good afternoon, everyone. First of all, I would like to thank the Filipino American National Historical Society for having me. I never dreamt to be on the history side of this. It's this kind of society, and I never dreamt of it. And this is a life opportunity for me, and I'm very proud and grateful to share my experiences to what happened to the pandemic. Before that, I would like to acknowledge first my family who really supporting me on this. They are the biggest fan right now, and I thank for them. And I am a nurse for 20 years here in the United States, and I've been back home. The home is Cotabato City, but down in South for 10 years. They say that you're not really a true Filipino if you don't have two jobs. I do have two jobs. So that's what they said. I do have two jobs on those two pandemics. I work as an intensive care unit, and life is really tougher, not unexpected, but we have to move on. I have the full support from my family, and the resources of the organization are there. And of course, there is a lot of kudos or collage that we have given in the media, that we have freebies, free bonus or something. But this kind of event, the post-pandemic era, is very good for us to give tribute to those healthcare heroes at the bedside. Again, thanks for having me.
Thank you so much, Vivian, for sharing your story. We appreciate it. All right, we'll pivot over to Rudy. Rudy, you're up next.
Hi, my name is Rudy Banlasan, and yeah, thank you for inviting me. to this for a Filipino American National Historic Society, I guess, interview. I've been a nurse for 7+ years, and the bulk of my nursing career is in the emergency department. Currently, I serve as a director of nursing in a skilled nursing facility in the Bay Area. And this is definitely that light at the end of the tunnel. Being in the pandemic, it kind of fast forwarded my nursing career. I felt like I've been a nurse for 30+ years. Worked alongside Goldie, of course, who's also being interviewed. And it's definitely been an honor to be a part of this. And to be honest, I'm not gonna lie, I'm a little uncomfortable using the word hero, because as a nurse, we are in a position of servitude, and that's what we do. So going in, taking care of people when they needed us the most, I think the society needed us the most, just being there at that time. We were just doing what we're called upon to do. So it's definitely an honor, and I'm glad to be a part of this.
Thank you, Rudy. Thank you so much for sharing. All right, Miss Goldie Smith, welcome. Thank you for joining.
Yes, hi. Thank you for having me. So yeah, my name is Goldie Smith. Well, I've been a nurse for, gosh, too long, 25 years or so. I just dated myself. But yeah, and majority of it also is in emergency medicine, more than half of it in leadership. So as Rudy mentioned, I did work side by side with him. We were together when that pandemic hit. And yeah, so it's kind of really interesting that we could now look back and actually talk about it. When we were going through it, it was kind of, you just didn't know what was going on, and being able to pivot and adapt with, whatever information we were getting was quite something. Hopefully just once in a lifetime, right? But yeah, so that's pretty much my background.
Thank you, Goldie. And really quick, I'll introduce myself as I'm a moderator today. My name is Jelissa Cummings. I'm the Chief Quality Officer in Kaiser Permanente here in the Valley. Nurse for 22 years. Paramilitary nurse, now civilian nurse, and yes, once bedside, now leadership. So, and the museum interviewed me I feel like June or July or August, something like that, of 2020. And it was still very different then. So I want to thank our panelists for being here, for being willing to share their reflections on the whole experience. The first question I'll put out to the group, excuse me, is it's almost like 9/11. You remember where you were, you remember what you felt, you remember, and again, if anything makes you all uncomfortable, by all means, just say pass. It's totally fine. But can you just share, like I think for all of us, it was very uncertain, right? We started hearing the news, and then it started to hit here locally, and it was like, okay, this is real. We'll start with you, Vivian. How, in the intensive care unit, how are you feeling? How are your colleagues feeling? What was the vibe that you were experiencing?
That question, I didn't prepare that one to answer. I have to full disclosure. My mother tongue is Filipino, okay? I may speak English on my conversation. So I remember when the 911 hit, I was doing my iron back home. It was in the TV. That was 2011, right? I was doing my laundry, and I was working on my status to come here in the United States. So that's where I am, and I'm worried that I cannot come. There will be more restrictions. So for me to go work and something like that. That's my fear. I dreamt that I was really ironing my board, and that's it. I'm hoping that I can come still in later. But here you go. And after 20 years, I'm here. And let's see how it goes. But is this I'm not really, if you have to compare between the 911 and the corona pandemic, the COVID-19 pandemic, it's different. I'm scared, but I have to really, this time I never look on the media. I just need to work and help this patient. That's like a regular work, and then follow the rules and the
Mhm.
PPEs, and let's see what's going on. The only thing that the media tells me how many what we call that positives we have. I'm gearing up myself that oh my god, there's full house again, and there's a lot of extension, whatever beds that we can make for this patient. That's where I am.
Thank you, Vivian, for sharing that. How about you, Rudy? When March 2020 hit, what was going through your mind?
Well, a lot of things. I actually had a trip planned with my friends from work. We were supposed to go to Japan, South Korea, Thailand, and we were excited about it. And then I remember having this conversation clearly with one of the doctors I work with in the emergency department about this COVID, or it was coronavirus then, that it was happening in China or somewhere in Asia. And then just, thinking about it, we were just kind of shooting the breeze saying, is this going to come here? We didn't think it was likely. And then kind of just the time sped up after that. And I just remember now having the whole country being on alert, and having the first confirmed positive, one of the first confirmed positive in the Central Valley as a patient in our emergency department. And I didn't think it was happening. I thought it was very surreal, but at that time, here it was. And I think what clicked in my mind was like, okay, this is what you signed up to be a nurse for. Action, here you go. So I remember that, and it kind of was a blur after that, and just a lot of things happening and changing. The whole Stockton, the whole state shutting down, and then different states, it was kind of a just panic mode, or a lot of uncertainty. The whole country and the world didn't really know what was happening, if this was happening, or if it was a hoax. I heard that mentioned, and seeing the patients come in like in droves, that's when I knew this was real. So
No, it was very real. Thank you, Rudy, for sharing that. How about you, Goldie? You both were in the emergency room same time.
Yeah, I remember how it started. It started with, oh, you have to ask these screening questions at triage. Did you travel to, and there's like a list of
Again.
yeah, just like anything, so I was the director at the time in the emergency department. And of course, you're rolling out these, hey, there's this new thing, and now we have to ask these changes. Oh, okay, and all the attitude that comes with change, and then I remember my dad had a plane ticket to go back to the Philippines on March 2nd. And I actually vividly remember calling him, and I'm like, you're canceling your trip back home. And he's like, oh, but I already paid for the ticket, Mind you, my dad is like, well, at the time he was like 79 years old, I already have the ticket, it's paid for. And I was like, no. You're not leaving. And thank goodness, because otherwise he would have been stuck in the Philippines for years.
Right.
And then it was just, that was the first change that I remember at work, was ask the screening questions. And then after that, I remember getting a call from, administration called me, because now public health, that the cruise that landed in San Francisco, and then they wanted specific hospitals to screen these people who came off the cruise ship. And we actually got I think 2 or 3 people that were assigned to our hospital, and it was a big deal, right? So quality director, chief nurse, me as part of the emergency department, it's like, okay, these people are coming, what are we going to do? We set up the hazmat tent, and then our infection control nurse, we had all of the PPE, protective equipment ready. And then, okay, where, you know, to the very minute detail of, okay, when they come, we're going to have them park over here, and then they're going to come out, they're going to go straight here, you know, into the tent. And then that happened. And then it's funny because then when the couple was inside the tent, we were all looking at each other like, the plan was we were going to get somebody from the emergency department to come in and swab them. But I was just thinking, gosh, the ER is busy, and who, you know, I ended up putting the PPE myself and went in and swabbed them. I didn't know if I was doing the right thing. And they were coaching me from the outside. Okay, go in the nostril and go, you know, I was like, okay. And then that was kind of the start of it.
Mhm.
And then I also remember then that particular couple, they went home, they isolated, but then a patient did present to the ED. They were also from a cruise, and she was sick, and she was our first positive patient that got admitted.
Mhm.
And then it was funny because the emotion, especially in the ER, because we were like, oh my gosh, you tested positive. Then we're thinking, were we all wearing the right equipment? Who was exposed? And then in huddles, we had to say, hey, you know, we have to be mindful of HIPAA because this is our one and only positive patient. So once we say positive patient, everybody would know that's the patient, right? So it's like how it was a lot of unknown as it was evolving. Rudy, I don't know how many impromptu huddles I've had, you know. I'll get
Numerous.
information and I'll just announce on Vocera, okay, huddle, everybody who's available, you know, there's new information. But it was the fear, especially I think for somebody in the ER, because we just don't know who or what, or, you know, people present and we have to take care of them no matter what.
Mhm.
And we didn't know if we had the right protection. There's just no information. And trying to lead through that was definitely quite an experience. So, I mean, I have like a lot of respect for all of the decision makers during that time. Because like I said, you know, you're being presented with information, you're making the best decisions possible, and then you're getting criticized on the back end, and you're handling fear on the other. It's definitely it was something. That's where I was. So.
No, you bring up a good point, because, you know, and when you're part of a larger organization, right, you're waiting for, you know, updates coming from regional, corporate, you know, whatever you want to call them. And then how do you cascade that? We used to joke to say, you know, it changed hour to hour, minute to minute. It's like, oh, the policy was this. 20 minutes later, it's like, no, just kidding. It's this. So yeah, it was very dynamic. It was a day-to-day thing. So no, thank you all for sharing, you know, what was going through your head, you know, when this started to go down. My next question is, so you guys mentioned things like, you know, we fundamentally changed a lot of the things we did, you know, where I remember being an infection control nurse. If I saw somebody wearing a mask, I would immediately tell them to take it off. It means you're sick, you need to go home. And now that dynamic had changed. So it was like, oh, now it's okay, and put on all your PPE. The other kind of very interesting thing that came out was, you know, when we really had to clamp down, right? We had to tighten everything, close off our organizations to the public, you know, screen people as they came in. The biggest part, I think, that in hindsight that was most impactful that I saw was, you know, the inability to allow visitors to be at the bedside with their loved ones. I'm going to start with Rudy. We'll go Rudy, Goldie, and then Vivian. I'll kind of do a rotation, but you know, how in your care, and especially Goldie and Rudy, you were in the ED, first line, and then Vivian, you know, you were with patients for a longer period of time when you needed that support. How did that affect your practice, or how did that affect your teams not being allowed to, you know, have visitors, you know, come in, family members, friends, you know, see your loved ones, especially if they had COVID and the prognosis we didn't know, right?
It definitely made it very challenging. You know, oftentimes in the ED, I'm not gonna lie, we prefer that we don't have visitors because they tend to be present more of a challenge, because now some kind of how should I put this, get in the way of our care when we're trying to take care of the patients themselves. But on the flip side, I actually did enjoy, or still do, having family members of whoever's sick, because they know the patient more than we do, and then they also provide emotional support and other support, and they can help us answer questions that we may have that the patient might not know. Now, having to limit that or eliminate that, seeing elderly patients, especially the ones with dementia, who cannot have visitors, definitely made it just that much more challenging. And it was kind of it was crushing to me emotionally also, because seeing them and being in an unfamiliar room or situation and not having a familiar face, especially having us wearing our gear, looking like, they're in and I guess I don't know, outer space, so that to me was heartbreaking, seeing that. And especially the ones, kind of fast forward to the ones at the end of life, and not being able to have a family member there present right at bedside. That was just heartbreaking.
Thank you. Thank you for sharing that, Rudy. How about you, Goldie?
Okay, I'm not gonna lie. Cover your ears shut. I probably went rogue quite a few times on that policy. They teach us a lot about patient-centered care, and especially, even running a code, when people are dying, they encourage family to be at the bedside, and studies have shown that there's closure. It helps with closure for family members, and then the rule, right? Like, no one dies alone. So that rule to me was, it was probably one of the hardest that I've had to implement. I'll share a story. One of our case manager in the ED, her and her husband dropped off their daughter to New York for college. When they came back, they both got COVID. Both of them are in the high risk category. And they got really, really, really sick. And, we were aware of that as a department, and, she had friends, and we were reaching out, trying to support as best we can. And then one day, the husband comes in to our ER coding. And so, of course, that news spreads like wildfire in the department. The staff told me, I came out, and we were in the process of trying to get back her husband, but his vital signs were going down. His, heart rate was like, it was very evident that he was not going to make it. And my question to the charge nurse was, where is the name, of our nurse? Where is she?
Mm-hmm.
And they're like, well, she's outside in the ambulance bay because no visitors are allowed. And my reaction was, what the heck is she doing out there? I was like, bring her in.
Mm-hmm.
And everybody looked at me like I had like two heads or something, and they're like, and then when it clicked in their head, they're like, yes, ma'am. Okay. I was like, bring her in through our code room was near the ambulance bay. So I was like, bring her in through give her a mask, put her in PPE, bring her in through the ambulance door, get her in the room. I mean, she's already infected.
Right.
Bringing her in through that, we brought her through the shortest route possible to the room to minimize exposure, put a mask on.
Mm-hmm.
And we did, and she, her husband did end up passing away, but at least I know that we did what was right by them, by bringing her in. And that's the story that sticks out, but I could tell stories of how many of those other patients who come in who are positive. And it's very interesting to see the staff reaction, right, of following policy, but then being human. And it's a struggle because there's, I mean, like Rudy said, I'm going to paint the ER nurses in a bad light a little bit, but we're like, we don't like families in the ER. They're they're a pain. It's like, because in the ER, we're moving fast, where we need to get our things done. And it's very hard for us to remember a lot of times that human aspect of, they're human. We're not a factory. They're not car parts. They're not, there's people there. So, I personally, I know that I was just telling the story to somebody else recently, like I said, I went rogue, but not really. I tried to stay true to the intent of the policy, which is minimizing exposure. And I did everything possible to minimize exposure, but also try to meet the needs of our patients and our family and our customers. Because, and I always try to put it, and when I explain it to the team, it's like, if that was me, I would want somebody to go above and beyond and to think outside of the box to bring that gift to my family, right? To have that. And I would only hope that the organization I work for would support that when decisions are made. And that's what I know as a director, that's what I would tell my team. As long as you have the best interests of the patient in mind at heart, and that's what you're putting first, I said, I will always have your back. I will always support you, because that's what it's all about.
Right.
But I mean, you brought up a very, very touchy subject. That was rough. I mean, it was, I could only imagine. I'm interested to hear what Viv has to say in the ICU people in long-term, long-term in the ER, long-term in the hospital and no family. So.
Thank you, Goldie.
Mhm.
Thank you for sharing. Go ahead, Vivian.
Oh, that's so touchy question, Julissa. I know that I'm the one always asking for visiting policy. And then
Yes.
we are the red light, the purple, whatever light that the state says. So we are all on top of that. So touchy. So it's very tough
Mhm.
decisions to see if they would like to be allowed or not to be allowed. um when the COVID hits, nobody knows the treatment and nobody knows. We are guided by the what you call that, who's that doctor or something,
Okay.
Oh,
Dr. Fauci's
Fauci.
recommendation. So we're
Yes.
guided for that. And then it's very hard. They are still talking. Most of the patient are talking. The COVID patient, they are talking, but they're short of breath.
Right.
You think them? Oh, they're talking. They're short of breath, but their numbers are not seeing that way. So as a bedside nurse, I learn from them, and then I start talking where we at, and they are in the first day make conversation. What are those things? Very, very important to see who are those um people in their mind,
Mhm.
very close friend, what decision they would like to do. Because in the day three of the trends of that progression,
Mhm.
the road will shift either on the left or on the right, but the outcome may not be the same. But my goal as a bedside nurse is to respect their wishes.
Mhm.
It's very tough conversation that we do, and but these patients that make their decisions, they would like to go through the process of artificial life support. They would like to do that. They wishing us as a bedside nurses to give them respect their wishes. And of course, it's very hard and very intense emotion when they cannot make it,
Mhm.
but I do my best to respect their wishes. The conversation of being with the family and very tough in the first 4 hours, first half of the shift is where there's a lot of tasks to do with this patient. I usually take care of myself first and what are the things that I have to say to the family. I told them when family will call, I will entertain them, but I will give time. I will call them. I usually after 1 o'clock in the afternoon, I will call them and give them their questions.
Mhm.
They are kind of annoying sometimes. They will not stop, but it sometimes it help boost the patient's um morale for those who can make it. And sometimes I to, to be straight for to be direct, I sometimes tell them, you stop talking because your oxygen is not doing good. And then you may have a tube on their throat and they don't like it, but sometimes it never gets them. It never gets them until you tell what's gonna be happening.
Mhm.
So the resources that my management did, we have still Wi-Fi. That's a very good one. If they have cell phone, very important piece of gadget. And to the point that we have to ask the family the passcode just in case
Yes.
you be medicated and you want to be in the life support, and I give them the chance to see where we at, and so that we will have to go together what the decision they have to make. And we have those FaceTime, whatever Wi-Fi that they have to do, but we have always to have to ask also to them that we have to maintain their patient's privacy, what to what extent that we are giving that information. That's my experience is. Yeah.
A lot of things to think about when trying to balance policy versus the right thing to do versus what you want to do. No, thank you for mentioning that, Vivian. I remember poor family, they're outside our ICU windows on the first floor, looking into their family. And I was finally like, we're not running a zoo. Let them inside. I said, are you sure, Jelissa? Yes. Yeah. Put this on. It's okay. Their family members dying. Do the right thing. So thank you all. Let's pivot to a slightly positive topic, a better topic. What have we learned from COVID? Like what would you share with your friends, your family? What would you share with future generations coming into healthcare? What were some good takeaways from COVID? Because we did learn a lot. If it taught us anything, it taught us how to appreciate life, how to take care of ourselves, those kinds of things. So we'll start with Goldie.
Yes, what did I learn? Wow. Well, like you said, life is precious, right? Like you just never know. And I think we've really learned to appreciate each other more. Just being witness to that, like like how life-changing all of that was. But I think also, if anything, the importance of communication, right? Like Viv said, it starts with Dr. Fauci. Who the heck is Dr. Fauci? And then he's on TV saying all these things, right? And then there's, for us here in California, it's highly regulated, and there's CDPH. And then it trickles down, like you said, if you work for a big organization, then it goes through regional, and then to the hospitals, and then to the directors, to the managers, to the staff. It's just like so many filters. The importance of quick, accurate communication, like getting pertinent information out quickly to the people doing the work, is because that's where it all happens. It's like all the decisions are made somewhere there in the top, but where it all happens, how do we equip the first responders, the front line? How do we equip them with the tools that they need, with the knowledge that they need, to get that, to be able to pivot quickly as things are changing? That became very evident to me in COVID. And because the thing is too, if you don't get at that information quickly to the people doing the work, they're going to make something up. They're going to do something, and it's not fair to them to have to kind of deal with it on their own, and it's not fair to the community. So like how to trickle that through. And then it's also like, it's not just one form of communication, right? Like you have to put it in writing, you have to talk about it, then you have to talk about it again, and then you have to talk about it again, and then you have to update, and how do you get it to all the stakeholders, and thinking about who all is affected by that. That's kind of a lot of things that I learned too, because every time I would make an operation change in the ER, it would affect so many other different departments, and vice versa. So trying to coordinate all that, I learned a lot through that. And I think it really helped shape my leadership style today, and my communication, and trying to identify stakeholders, and really looking at that. And then the rules, right? Like you said, when to bend the rules, and when to do what's right, and how to bend the rules the correct way.
Right.
Because rules are there for a reason, and really trying to balance the intent of the rule, but also knowing and being aware that we're dealing with humans. This experience for sure, if anything, reconnected me to the human, to patients. And that's really something, especially when you've been a nurse as long as I have. Sometimes you get burnt out, you get jaded, especially in the ER, it's just the grind, and you tend to boil your job down to tasks, and just need to get this task done and this task done, and move on, and you lose sight of the person. So this for sure, having to deal with patients, having no visitors, having this, it really made me appreciate and reconnect again to the human aspect of what we do. And I try to hold on to that now that COVID is over. Well, kind of over. I want to be able to still hold on to that, and hopefully, as I continue to lead my teams, help them hold on to that as well, and not go back to boiling our job down to tasks that we are dealing with, humans. So
That's a great reflection. Thank you, Goldie. That's really good. Vivian.
Fun fact. I will say what would change. Okay, fun fact. I would say because we are proning a patient, we are proning a 300-pound guy. We run out of our rotation bed, so we are the prone person. Fun fact. I have enjoyed myself. What changed for myself first? To do some weightlifting, some treadmill. I collected toys. What I mean, my gym toys, my treadmill, my stationary bike, my weightlifting. I have to have my self-care, they said.
Yeah.
For 20-minute time. So that really helps. And also I have that what changed is also my water. My water is look like sinigang. There is luya, there's a ginger in there. There is lemon in there. It's like paksiw. So there's in the that really I believe that because of that COVID is respiratory tract infection. I don't really I want my nostrils and my throat to be cleared out. And the fun fact also is that when I drive one time going to work, this COVID really changed not for everyone. There are people who lost their jobs, and I was so grateful that I'm not that one. But I have to be taking care of myself and make sure my family makes some changes too. We don't we follow the rule. Um, uh, I'm kind of saying that we have we are lucky we have rooms. My husband and I sleep for not until that vaccine is there. The vaccine is there already available. We have to be losing our restrictions at home too. That's where we are. And I have to learn to appreciate life decision. These are the most important piece of strong important piece of our lives to make decision. It's not like giving a birth, having a family, but making decision for yourself what to do at the of that kind of event is very important piece for us.
That's very true. And you never, I mean, they talk about end of life decisions, but you never know when that is. We should always have those conversations. The number of challenges we had with families that were pinned against each other on, you know, life sustaining care or what's the best thing to do, quality of life. And it really brought to the surface, hopefully it made people more sensitive to, you know, thinking about those things. You know, it's not a taboo subject. We should be talking about it all the time. So thank you, Vivian. How about you, Rudy? What good did you get out of COVID?
Well, definitely several takeaways, but I think one of the most important one is that it really underlined how important our health really is, because as everyone knows by now, the people who didn't do well or the people that have passed away from COVID are the ones who weren't healthy, right? Or had several comorbidities. So it really underlines how, you know, a healthy person is able to withstand COVID, or if they did get it, you know, to come out okay. So it really, to me, and what also was mind-blowing to me, that our society, there's such a lack of fundamental health knowledge. And I think that's really what I'm passionate about. Is I think we need to educate our people more on what we can do really to start being healthy. And because there's a lot of chronic conditions that have made COVID really a death sentence. Had they not had those chronic conditions that could have been prevented, they would have done well, you know. So just a lack of fundamental health knowledge that our society has. And I think moving forward, I think it will do you know, future generations really well if we were to, like, again, go back to the basics, having a healthy mind and body, you know, because especially with the isolation that we had to do and in COVID, it affected mental health, you know. So having a sound mind and body, and going back to the basics and how really important those things are, is my biggest takeaway, are my biggest takeaways, I think. And just, yeah, we need to do better. You know, starting from grade school, from a lot younger, and, you know, by just simple hand washing. And, you know, it's funny, well, I guess I can bring this up. During the height of COVID, when everyone finally wore masks and, you know, it was the thing to do, I don't remember having one case of the flu or RSV for that matter. So, you know, wearing a mask is effective, and wearing it properly And, kind of funny thing too, when I see people or by themselves in the car wearing a mask, I kind of laugh at that. I'm like, so, that just underlines how, again, health knowledge, is lacking. But I think hopefully, we can pull together as a society and teach our people a little more and how important our health really is. Then, to learn from this and to hopefully prevent the next pandemic from happening. Yeah, I mean, that's really what I take away from it.
Mhm. No, thank you, Rudy. If I could go on a 1-hour tirade about oral care, I'm all about oral care. That's a separate talk. We'll have another talk about that some other time. But that's actually very important to good health. I think we're coming up. We got a few more minutes left. My last question is, because Filipino Americans make up such a huge part of healthcare, not just in Stockton, not just in California, but everywhere. But we did take a significant, as an industry, took a significant hit, during COVID for a number of reasons, for folks who couldn't handle the pressure, and that's where I applaud the three of you, because you obviously have stuck through it. Vaccine was another interesting topic, people who didn't want to get it, which, we respect their decision, but, what are your suggestions for how we can better inform those coming into healthcare? How can we support them? How can we mentor them? How can we get them to understand that this is a lifelong commitment? It is about caring for your fellow man. What suggestions would you have on, how we could market healthcare? As it's not, I mean, even though through COVID it was pretty intense, but at the end of the day, it's a very fulfilling and rewarding career. I'll start with you, Vivian. What would you say to young generations who are contemplating being a nurse, a doctor, or a respiratory therapist, or anything else in healthcare?
I didn't prepare that question. 1 second. I will have to think. For me, it's still the rewarding profession.
Mhm.
I learn from them, and I learn real-time experiences and how to present this situation of like the life-ending decision. I have a patient, I call it Mr. Biker, because he is retired, and he just retired, and I learned from him those kind of experience, to whom we will take care of that finances, the dog, the bike, and those are things that you don't, how to approach it in a real-time situation. Those are not in the books. Those are real-time experiences. Getting in this profession, that's why I'm not leaving bedside. I may change, but I'm not leaving the bedside because of that. There are experiences on how you approach life in the real world. So and also it's supported. I think healthcare profession is so well supported. Resources, we are from federal to state level to the hospital there, it's supported. Just know how to make that resources. That's how I see to those advice to those coming in this profession.
Thank you for that, Vivian. Very, very key point. Very important point, actually. Rudy, because you're now in the skilled nursing world, and they too
I am.
took
Yeah.
get hit, in terms of resources. Well, what suggestions would you have?
I think we really had to, ask them the very basic question. Like, if you're interested in healthcare, what is it for? Are you in it for the money, or are you in it for the passion? You really have to do a lot of self-checks, right? If you're in it to be a servant to the community that we serve, then I think you're in it for the right reason. Because a lot of people have left the healthcare industry, not because, they weren't in it for the right reasons, but a lot of those who have stayed are in it for the right reason, because we really, I hate to sound it's a calling, really. So I really feel that, I was called to serve, our community. And if you are passionate about taking care of people who are less vulnerable, who are vulnerable, and you're in it for the right reasons, and you will do well. And as long as you're ready to serve, it's a very rewarding career. You could come home every day thinking, oh, I've made a difference. I helped save someone's life today, and I made somebody happy. I made somebody smile. So that's very rewarding.
Thank you for that, Rudy. Great perspective. All right, Miss Goldie, you get the last word.
Yeah, I agree with Rudy. I think it is when you go in, really, I would advise people to really do a good self-reflection on why you're going to go into the healthcare industry. It's not, you can't say job stability, because healthcare lays off too. You can't say money, because at the end of the day, that motive will burn out real quick. And then there's a lot more to it. It's like, you go in there and it's hard work. But the rewards, if your intentions are like Rudy said, to serve, it's definitely very rewarding. I would say do your homework, a lot of self-reflection. It's not like TV, it's not Grey's Anatomy. It's funny because I was, just recently, I would help out sometimes, and the patients, they would tell me, they're like, oh, this is so, I currently work in a teeny tiny ER, so we treat patients in chairs and hallways and everywhere, and every nook and cranny, and apparently it's entertaining for them because they see everything that's happening. It's like, this is so cool. I watch Grey's Anatomy all the time, and I'm like, this is not Grey's Anatomy. But it's really glamorous and fun at first, but that's very shallow. So really, in the end, to be able to survive a pandemic, or even just day to day, I mean, in every aspect of healthcare, you, like I said, I mean, I sound like a broken record. You deal with humans, and these humans, like Viv said, they're not, it's not having babies all the time, and it's not celebration all the time. They're in crisis. You deal with humans at a very vulnerable time in their life, and if you're not ready to give a piece of you every single time you go out on that floor, you're just not going to make it, because it takes from you, but it also gives. But you have to go in with the right intentions to be able to experience that. Probably a little too deep for people going in. I'll probably scare them away. But that's what elders do, it's just like
We need them.
yes.
We need them.
Fresh blood.
But the thing is, what? I am committed to supporting newcomers. Please send them. I'm committed to mentoring. It's one of, aside from taking care of patients, helping our young be successful is also, and I preach that to the team as well. I was like, we do not eat our young in this department. So it's that's what I would say to them.
Thank you, Goldie. That was a perfect ending, but it is.
Jelissa, can I make a comment on
You can make a comment on it. Go.
something that Rudy said, and it's real quick. I have had the opportunity to interview World War II veterans, and they deferred any kind of hero talk, even though you read what they did. Rudy, Goldie, Vivian, what you guys did, I don't know what the definition of a hero is, but you guys are definitely well appreciated and should be, the tribute is yours. The other thing is, Vivian, you made a comment about the dignity of, my mom, she passed away in April 2020, and we didn't have the opportunity to, she died alone, but yet every one of the caregivers in the skills facilities showed compassion, humanity, everything that you guys embody here. So with that, I just wanted to say, hey, one thing, and then one last question for you guys. To you, Goldie. If you were to be able to go back in time and go to your pre-March 2020 self, what would you tell yourself? What would that be? Anything that you had learned, or just so yourself, you would be able to be better equipped for the next few years?
I would say just what I learned, stay positive, hang on to the core of what we do, the human aspect of it. Because there were plenty of times where I was frustrated with the politics, frustrated with how politicized it became when people were dying in front of me, and I think I was able to do it, but I would definitely go to my pre-COVID self and say, when you're frustrated, hang on to humanity, because that's what it's all about. The politics and all of that, that's just noise. At the end of the day, we're here to take care of each other, take care of, coworkers, patients, family, take care of each other. And that's what it's all about, and keep that in the core of everything that you're doing as you're going through, what you're going to go through. So that's what I would tell myself.
Thank
Hang
you.
on to humanity. Yep.
Vivian, do you have a perspective?
My perspective for 2020. Oh, you put me on the spot. How much? I would say I am keep the life ending decision is very tough conversation. I will say that's really if that COVID never hits, and I will not probably say, I will say, oh, this is what I do. I just, if the patient's pneumonia, just treat them, blah, 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 blah. But that I have to start have conversations with the family, and where we at. And we approach them on that. And if they don't have that decision, help them go to that process of life-changing event. That's where we at. And also the impact on my family. Of course, we Filipinos don't talk to that much. We have to see where we. I'm sorry that my husband gonna kill me here, but I have to assess where he is at and what his conversation is. Every day, not all, most of the time, seasonal. I never talk any COVID at all at him at this. I never talk anything at work. So had to see what the conversation where we at, just in case it happened to one of our families where we at right now. If that COVID, it's very, very, if that experience never happened, maybe I may be devastated. The approach may be different, may not everybody liking it. So that's my biggest takeaway.
That's very important. Thank you, Vivian. Yeah, you did good about not bringing work home. That's very hard, especially with everything going on.
Yeah.
Rudy.
Well, I think so, the pre-COVID me, what I would tell myself then would be that the human nature, humans in general are resilient, and that whatever we're faced, we're going to find a solution, and that there's going to be light at the end of the tunnel. And And, sure enough, this light at the end of the tunnel talk, I can definitely relate. Jelissa was there. You were there when we were doing mass vaccinations, at the Stockton Arena. And to me, that was the biggest light at the end of the tunnel, that the end was in sight, and that this too shall pass. And, that's the thing that I would tell myself back then, that, hey, you know what? You're going to get through this. We're going to get through this together, and we're going to come out stronger. And, we're going to be a better, or we're going to be better to ourselves, to each other and our families. And we're going to be a better world, because we're going to withstand the test of time. And this really was a true test of how humanity, how we're going to get through this, and with strength. And we're here now. And to talk about this, looking back, it's amazing. I took a picture when I was getting vaccinated. I sent it with one of my older nurse friends who have retired since. And it was kind of emotional, because she equated it to like how they ended polio when they were, people were getting vaccinated. There were mass vaccines given to patients, to people, to prevent polio. So, polio is, to me, is only in our history books because of vaccination. And, hopefully COVID will, it's reached its endemic stage, and mostly because of prevention, vaccination. And lesson learned, that the resilience really of humanity, that we can get through this.
That's wow. So true.
Wow.
It will not be the last thing we encounter unless we read now. But we always figure it out. So thank you, Rudy. That's very, very positive outlook on things. So thank you. Erwin, did you have any other?
No, I just total gratitude and appreciation to you all, everything you guys did, holding our society, our world together. So thank you again.
Well, I will echo that, because I mean, we've got very, professionals that I've worked with, I still work with, I encounter, and, when you guys came to me with this topic, I'm like, I know who I want to ask. And, whether you're in the hospital, whether you're in the emergency room, whether you're in skilled nursing, thank you, the three of you, for taking your time out. And we'll memorialize this. And when Terry sends the link, I'll send it to you so you can share with your friends. And, again, we want to highlight the contributions of Filipino Americans to history, and you guys have truly left your mark. So thank you all very much.
Thank you. Definitely been an honor.
Okay, thank you. Bye-bye.
Yeah,
All right,
thank you all. Yeah.
Thank you all.
Yeah. Okay. Go ahead, Jelissa. You can.
Oh, no. If you want to close this out, that's fine.
No, I just want to, thank you guys for, for sharing your stories, because I think, and boy, I was taking a lot of notes, because I was thinking this is so important for people to hear. So I'm definitely going to get this up on YouTube as soon as I can this week. And yeah, these experiences, it's there's a lot of healthcare people in my family, and so I kind of understand a little more also about what they've went through these past few years. And I have a cousin who's a public health nurse there in San Joaquin County, and I always had to keep asking her, okay, my sister's got COVID, do we go there or not? And they had, so anyway, this has all been very, very interesting, and I thank you guys. And this is what we're here for, is to get this information, share it, and hopefully future generations can learn from it. And thank you very much for sharing your stories.
Yes, thank you. Thank you, Goldie, Vivian, and Rudy. I appreciate you guys so much.
We will see you again in the future.
Yes, in person maybe for a future
Yes.
one.
Okay. Thank you.
You guys take care. Have a wonderful rest of your Sunday.
Thanks
Thank
for
you.
having us. Thank you so
Absolutely.
much.
Take care.
Take care. Bye.